we just talked about patients or people nowadays are very web-based, very internet-based. They want to. People can't live without like a BlackBerry or a computer. Okay, so when they come into the hospital, some patients bring in their computer. And when this first began, we have sites where they go and work. We have a lounge where there are a number of computers. We have outpatients departments where they have computers and they can check the email and they can surf the net on that. So slowly we sort of wire up the hospital so we have Wi-Fi everywhere in the hospital so they could actually bring in the computer. All these sort of progress in the IT business or industry of the world. So now the actual hospital is wired, so you can see patients and also relatives, visitors. They're coming in. They bring the computer and they're happy spending their spare time on it. And then the hospital come in and say, well, when we make up our new accommodations for hospital patients, we could have a system whereby they could watch TV, they could make a phone call, and they could also go on the internet and a system. So that's why we put in an info entertainment system on the bedside of the patient, and then we call that an IE buddy, and that's how we take technology to the bedside of the patient, providing information and entertainment for the patients while they're in the hospital. We did ask them; they're quite happy with the system. Okay. Well, of course, sometimes it's an electronic device. Occasionally, it might break down, like when you're on a plane and the little TV in front of you are not showing the program that you're after. That it will get a bit frustrated. But actually, the system is quite robust and seldom break down. And when the patients coming in, when we look at it, not a great percentage of our patients are okay. They come in for operations, and after a day or two, they would be able to move around. They are quite mobile, but before they're mobile, they're in bed. So bed bound, and when we have this system that can actually pull right in front of their face, and they sit up and they can watch TV, and they could get connected with the world through the internet and email. They're quite happy, and you can walk around the hospital and see a lot of patients are using the system. Okay, and the system also beginning to help our nurses in things like dispensing drugs to patients, in making sure that the right patients get the right drug. And when patients look at that, they feel more confident in the hospital, and also in the tablet they are about to take. In this day and age of media coverage of certain medical problems in hospital, like wrong drug to patients, they would feel more confident. The IE Buddy now installed in every bed. Okay, so patients get to use it, or all the patients get to use it, no matter you stay in a general ward or semi-private ward or private ward. All beds are equipped with this info entertainment system called IE Buddy, and it has a capacity to for nurses to use the system to dispense drugs to patients. Okay, that has been introduced slowly because it's a system that you need to get used to. Okay, by using it. So I think it is now introduced to a number of wards, but not 100% of the hospital is using it. So the next step is for doctors. So it has also a provision for doctors to use it for looking at films, X-rays, and laboratory results, and some patients' sort of information on the IE-Buddy, but that has to be introduced because we have a large number of visiting doctors in the hospital. We have a much smaller number of, we call in-house clinicians. They work in the hospital. So this is the group we're going to start first. So we're going to start with the in-house group and then moved on to the larger group of visiting doctors. We have 1,400 visiting doctors. So it's a huge job to teach everyone to how to enter the system, to use the system efficiently. All right. So I think it would take a few years to teach clinicians how to use it so that they could use it more often.